We'll wait for others to join in. We have started the broadcast. We will just start the session in a minute from now. Right, shall we start? So,
yeah.
Hello, good evening, everyone. For the day one of 47th annual conference of KCIAPM, that is CAPCON 2020 virtual conference. Our theme for this year is Adapt, Learn, and Network. And as you can see, and as you've experienced since morning, CAPCON 2020 is just a click away from you. So today session, we have already completed 3 sessions, and we are now in the 4th session, that is social media and digital pathology at 5 p.m. And we have one more session left at 8 p.m., which is on GI pathology. Please do join us for that. We are currently broadcasting from Sri Dharmasala Manjunatheshwari University, who are our broadcasting sponsors, and our software sponsors are MR Parthasarathy Oration Trust, Medical Education Trust. So without wasting much time, we'll begin the social media and digital pathology, which is one of the most excited and most awaited sessions in CAPCON 2020. We are eagerly looking forward to this. And our experts for this session are Dr. Jairam Iyengar, Managing Director, Newburgh Anand Diagnostic Reference Laboratory, and Dr. Vijay Shankar S, Professor and Head Department of Pathology at AIIMS, BG Nagar. So I'll hand over the session to Vijay Shankar, sir. Please introduce.
Yeah, thank you, Aditya. Welcome everyone to, as Aditya said, one of the most awaited session in CAPCON 2020, that's social media and digital pathology. As you all know, social media is basically a powerful tool for basically networking and collaborating and sharing ideas. But then, can this be used for education? Yes, that's what we are here for, to know from one of the most important person of related to social media. That's, I can say, he is a doyen of social media in pathology education. That's Dr. Gerard Gardner. Okay, to give you a brief introduction about Dr. Gerard, he is a consultant dermatopathologist, Giesinger Medical Center, Pennsylvania, USA. Dr. Gardner is a dermatopathologist and bone and soft tissue pathologist at Giesinger Medical Center, as I told. He was formerly an associate professor of pathology and dermatology and dermatopathology, fellowship program director at the University of Arkansas for medical sciences. He obtained his MD from Tulane University in New Orleans, completed residency in anatomic and clinical pathology at Houston Methodist Hospital, and completed fellowships in bone and soft tissue pathology and dermatopathology at Emory University in Atlanta. Dr. Gardner has over 110 peer-reviewed publications as well as multiple book chapters. He is also the author of the book called Survival Guide to Dermatopathology and co-author of the book Survival Guide to Soft Tissue Pathology. He is particularly interested in cutaneous soft tissue tumors, skin adnexal tumors, medical education, and the most awaited, the professional use of Twitter, Facebook, YouTube, and other social media for pathologists. He is an active volunteer member in variety of sarcoma and other rare disease patient support groups on Facebook. He has used his relationship with these patient groups to conduct formal medical research and to advocate on behalf of their diseases. His work has been recognized by multiple awards, to name a few, including the UAMS Chancellor's Teaching Award for the Best Teaching Excellence, which is the university's highest educational award. He is also the top 5 member of the 2017 40 under 40 by the American Society of Clinical Pathology, and was ranked first place on the 2019 Power List of the Pathology Trailblazers issued by the Pathologist magazine. Dr. Gardner is chair of the social media subcommittee and is also a member at large on the board of directors of the American Society of Dermatopathology. He is presently the Deputy Editor-in-Chief of Archives of Pathology and Laboratory Medicine. And not to forget to mention that Gerard says he loves masala dosas. I'm sorry, Gerard, you're not here. We could have hosted you for the masala dosas. Over to you. The stage is all yours.
We'll get him a virtual masala dosa.
Yeah.
Over to you, Gerard.
All right. Can you see me and hear me okay?
Yes, fine.
Yes.
Please go ahead, sir.
Excellent. Well, good evening to all of my friends and colleagues in India, and good morning from me here in America. You can watch the sunrise behind me here in central Pennsylvania, where the fall weather is just starting and the trees are beginning to turn beautiful colors. It is a true honor and privilege for me to be visiting virtually India for the first time and giving my first live lecture in India. And I'm going to talk, of course, about social media and the different ways it's changed my career and my life, to give you some ideas for potential benefits and uses that you could employ social media for in your own practices. I do have some conflicts of interest financially, most notably for this talk. I do make some money from my YouTube channel. So if you're watching my YouTube videos, I do make a little bit of money from that. So just so you are fully aware, and you can find full details here at this link. Also, I have a social media guide on my website. You can see the link down there at the bottom. It'll be up throughout the talk. That answers a lot of common questions for beginners who are trying to figure out how to use social media professionally. And these are my 3 daughters. This picture's a few years old. So I'm training up 3 dermatopathologists in my household, hopefully. We'll see what happens. And a huge thanks to Vijay Shankar for inviting me to give this talk. Obviously, he's known and respected all over the world because of the work that he has done with Twitter and social media to educate others about pathology. And it's just a perfect example, I think, of how social media can really powerfully impact your career and benefit other people around the world. He has 6,000 followers, over 6,000. And I would never have probably met Vijay if it wasn't for Twitter. And I would not be here giving this talk if it wasn't for Twitter. So this is just a perfect example of why social media matters so much in your professional career. And also, I think of the many wonderful friends I've made around the world through social media and how much that's enriched my life. And I just can't imagine not knowing all those people. So that's why I have to use social media. And I'm right here. This is where Pennsylvania is, and I am giving you a talk from 13,000 kilometers away. And that's the magic of social media making that happen. And again, I wish I was there in person, although it would have taken me probably over a day to get there. And then maybe not even a masala dosa. Maybe we could have a Mysore dosa, Karnataka style, and you guys could educate me about local cuisine the way it's supposed to be eaten. So hopefully after COVID, we'll make that happen in real life, and we can go eat some dosas together. So I use social media for lots of different things. I think teaching is one of the main uses that I use it for, but there's a wide variety of other benefits that you can get from social media. And here's an example of my professional Facebook page. So most of you probably use Facebook and have a personal account, but when you're on Facebook and you see something that has a button like at the top instead of add friend, if it says like, that's a page, and a page is basically like a public page, or like almost a mini website where you can put things out that can be seen by anyone on the internet, even if they're not friends with you on Facebook. So this is a perfect thing for pathologists who want to educate with social media, because it allows them to share images of pathology, pictures, and other things like that, and they can be seen by anyone. And that way you don't have to be friends with everyone else. So a lot of people are concerned about privacy, and this is a perfect way to keep your personal account private while allowing other people to benefit from your educational posts. It also protects your friends and family who may not want to see pictures of scurvy or amputation specimens or something like that. So a lot of my friends and family don't like that, although some of them do. There's my stepmom, Debbie, is one of my followers. My Aunt Cindy is like one of my top 100 followers. Neither of them are doctors. They just think it's interesting and they follow me, probably just to make me feel loved and supported, and so it works. So you can see that this is an example of scurvy here, and this post reached 9,400 people. And what's really cool about using Facebook pages as opposed to a regular Facebook account is it gives you all this granular analytic details about your post, how many people liked it, how many people loved it, how many people followed you or unfollowed you because of it. And that's free. You get all that information for free. This post of Giardia on a cytospin got 20,000 people got to see that. And it took me 30 seconds to make that post. So that's an incredible reach, even for someone like me who does tons of teaching and I give lots of lectures. I can reach far more people with one Facebook post than I'll ever reach probably in real life face-to-face lectures in like a decade of time. And the reason this analytics stuff is really cool is because as an educator, I want to know how my students are responding to my teaching, right? And we try to do that in the traditional classroom setting by surveying our students, but it's hard to get good data that way. Sometimes the students don't even remember your lecture, or they barely do because it was a month or two ago. And so this is a great way to find out what kind of content resonates with your audience and what kind of teaching they respond to, because I think all the people online who look at my posts and my videos, they're basically my online students. And so I want to know how my teaching is working for them. And I use Twitter to do similar things. I basically the same kind of content that I share on my Facebook page, I also share that on Twitter. And that's because some people like to use Twitter but not Facebook, and vice versa. So this allows my educational posts to reach the widest number of people possible. So here's a nice example of beautiful bone remodeling here. And here's an example from right in your neck of the woods, a great case of gout. So there's lots of stuff on Twitter that can be shared, and you can see people really like this kind of content. And again, Twitter also allows you to have analytic information. So when you have a Twitter account, if you want to get this kind of information, you have to go to analytics.twitter.com and log in with your Twitter login information. And after one time of doing that, it will basically ask you, can we track your analytic activity? And you tell them yes. And then Twitter will begin showing you under each post how many people saw the post, how many people clicked on the links in the post, and you can go to the analytics.twitter.com site to see how many views of all your tweets there were in a 1 month period. So I had this one particular month, I had 660,000 impressions. That's tweet views, the number of times my tweets scrolled past someone's eyes on a screen. That is a huge reach. That's a lot of people. And when you start out, obviously, you won't have that kind of reach. It comes with building up a following over time. But the point is in my real life teaching, I could never possibly reach that many people, never. And I do similar things with Instagram, although on Instagram, a lot of my followers are younger. They're not doctors. They're either medically interested members of the public or students, medical students or pre-med. So I don't spend as much time posting granular details about how to diagnose rare sarcomas, but I post things that are kind of beautiful and interesting that could appeal to a wide audience, and also fun things I do and people I get to meet. And here's me right before I interviewed Richard Scolyer, a very famous melanoma pathologist from Australia. I interviewed him last year for the American Society of Dermatopathology, and you can check that video out and a lot of other interviews on the American Society of Dermatopathology's YouTube channel. It's really, really great, amazing stuff that these people have to offer, and I've been really honored to get to interview some wonderful pathologists that way. And you can use it not just to teach with some pictures, but say you write a paper that's published in the peer review literature. You've already done all the 100 hours of work to get the research done and to publish it. Why not take an extra 5 minutes and share that on Twitter and Facebook so that more people can see your paper and read about your work and learn from it? So here's a paper I wrote with one of my greatest mentors, Dr. Jay Rowe. He, more than anyone else, is the reason that I am an academic teaching pathologist, because he gave me a real deep love of teaching, and that's why I pursued teaching in my career. And this is a great paper. It's available free, by the way. The journal kindly made it free and available for everyone. And it's about a basic approach to how to diagnose cancer, how to look at a slide and figure out if it's a tumor and if it's a mesenchymal or epithelial, if it's benign or malignant. And it's Dr. Rowe's method, and it's just so fantastic. I will make a YouTube video about it at some point when I get a bit of time. So I was honored to speak in Dr. Rowe's honor. He won an award from one of the Korean pathology societies. And a year ago, I gave a talk about how I use social media for education. And I wanted to show the power of social media for teaching. So as I was boarding the plane to go to the meeting, while I was walking down the jet bridge to get on the plane, I made this tweet, and I just wrote a little summary about the paper, a link to the paper on PubMed, and a couple screenshots of figure images from the paper. And I tweeted that at 7 in the morning. And the next morning when I woke up, right before I went to go give the lecture in honor of Dr. Rowe, I checked the activity, the analytics, and look, 6,000 views. 6,000 times that tweet was viewed in 24 hours. So that is a huge, vast way to disseminate the published works that you have. And again, it won't be that way when you start out, but with time, you can really reach a lot of people. And you can even see that maybe 6,000 people saw it, but look, 220 people actually clicked the link to PubMed. Maybe they didn't read the paper, but they know the paper's there and they have the ability to come back and read it later. You might ask, well, why does it matter all this, how many people see your post? Isn't that just ego or vanity? Well, it does feel nice to be loved and to know that your material is reaching other people and resonating with them. But I think if you're doing something, if you're writing a paper or sharing information, to me, in my way of looking at the world, my worldview and my career goals, I want everything that I do to hopefully benefit other people, to benefit my colleagues around the world, and eventually to benefit sick people, patients. And so if I'm posting something that's going to be helpful to someone, then I want it to reach as many people as possible in the hopes that some patient somewhere out there, maybe in India, maybe in Ethiopia, maybe in Europe, can be reached by that information and have a better diagnosis made for them that will hopefully impact their patient care in a positive way. So you may say, well, I already use Facebook, so why Twitter? I mean, aren't they the same? Well, they're very different actually. And what's really cool about Twitter, there's a huge pathology community. We call it Path Twitter. And there's over 7,000 pathologists by my count. I keep a manual list of all the pathologists that I find on Twitter and other pathology related accounts. And there's many more that I have not been able to keep up with adding to the list. So the number might be closer to 10,000. I'm not quite sure, but it's at least 7,000. And it's this instant connection to this amazing, warm, friendly, global community of pathologists. It doesn't matter where you live or how famous you are or what your academic rank is. Everyone's on the same playing field and anyone can ask questions of experts and interact with the top pathologists in the world right there on Twitter from your phone. It's fantastic. And it's cool because Facebook is really, a lot of people use Facebook only to be friends with people that they already know in real life. They're not as comfortable being friends with people they've never met, but Twitter is meant to be public. So it's really easy to meet other people and follow each other, even if you don't know each other in real life. And that has led me to know so many wonderful pathologists like VJ and so many others. And that has really been such a positive thing for my life. It's really made, beyond just benefiting my career, it's made my life so much more rich and full to know all these wonderful people around the world. So if you're not using Twitter yet, you are really missing out on something truly special and wonderful. Here's a great example. This guy right here, amazing. Sanjay Mukhopadhyay, you all probably know him, a famous lung pathologist from Cleveland Clinic. But we would have probably never got to know each other, even though we're both pathologists who go to the USCAP meeting. This is the United States and Canadian Academy of Pathology meeting in 2017. And we had met each other because of Twitter, got to know each other really well. And this is our first meeting in real life that year. And even though we had never met face-to-face before, we met on Twitter and then in real life. We call that MOTTIRL. And it's this amazing experience to finally meet someone face-to-face who you've only known over the internet. And it's like we knew each other forever, like we're long lost buddies. And so, you know, that's a really wonderful thing. And I think that it's this really incredible experience to get to meet people online. And it's one of the things that reminds me that just because you and I are talking to each other over the internet from thousands and thousands of kilometers apart, we're still real people on each end of this connection. So why should it matter that the medium that we're communicating through is digital? We're real people on each end, and relationships formed on social media are very much real. They're not fake just because they're through a phone or a computer. And this is one of the many, many points of evidence and proof of that in my life. And when we get together, this was at the 2019 USCAP meeting, all these people from all over the place know each other and are friends with each other, all because of Twitter and Facebook and social media. And it's just this powerful, wonderful experience. So you might think, well, the teaching is all great, but what about like real hardcore research? You know, I work at an academic place, I need to get promoted. Well, real research can happen because of social media. This is a piece of cartilage in a mediastinal lymph node, and someone, Lara Piwan, shared a picture like this on Twitter, and it turns out that other people had seen this when they looked back at their mediastinal nodes, and it was because the cartilage was pushed into the node from an endoscopic or endobronchial FNA. And the idea came up that maybe this could be a research project, and all of these pathologists, 24 pathologists from 5 countries, came together, got official ethics board approval to do this research, and published the paper within about a year of this original tweet. And in the American Journal of Surgical Pathology, a very prestigious, maybe one of the most prestigious surgical pathology journals in the world. And this paper 100% happened because of Twitter. And so Facebook is also good for discussion groups. And this really, I started these 2 discussion groups about 7 years ago, early in my practice. And now they have tens of thousands of members, and there are discussion groups for pretty much every subspecialty of pathology, numerous teaching cases shared. It's a great way to also share and learn. And this was really the turning point for me when I made these groups and thousands of people started joining. That's when I realized, wow, social media is where it's at. This is where I need to spend my time in my career. And that's worked out really well for me. And I'm very glad that I went that route. So here's an example. You can make a post in one of these groups, like my friend Sandhya from India. And then you can have all these comments and 80 some comments back and forth from around the world discussing a pathology case. It's beautiful, it's awesome, and it's a great way for learning and sharing. And it's just another method that you can use to interact with other people and talk about pathology. And we published a paper about this back in 2016. So at that point, I started my medical practice after my training in 2012. So 4 years into my practice, I published this paper about using Facebook. And look at all these co-authors from the US, from Saudi Arabia, Tunisia, Brazil, and India. At that time, I had only met 2 of these people, Raul and Rhonda, in real life. Everyone else I only knew online. And yet we were able to publish a paper in the peer-reviewed literature together from around the world, all because of social media. And so even if my department head or the promotion and tenure committee at my institution, even if they didn't think that my social media work was important or valuable because it's not traditional academic work, well, the papers I publish that are in PubMed, those count as official publications, regardless of whether they're about Facebook. So even the opponents of social media who think that it's a waste of time, they have to admit that the papers that are published in the peer review literature, they count as official academic work. And in fact, of my 100, and I think I'm up to 116 publications, I think 28 of them are related to social media. So it's a significant subset of my published work is related to social media. And it's not just people from my generation. Philip McKee, who is retired, a famous dermatopathologist who worked at Harvard and at the Dermatology Institute of London and has really published book and papers and so many things in his career. He got famous the old-fashioned way, and now he's retired and lives in a small town in rural France with his amazing wife, Gracie. And he joined Twitter and also Facebook a couple years ago, and I contacted him and said, Dr. McKee, I'm a huge fan. I'd love to help you with social media stuff. And so that started this wonderful friendship between me and him. And then he eventually created the McKee Derm Facebook group about dermatopathology. And every day from his retirement, he comes here to this group and looks at cases and makes comments and teaches people from all over the world, regardless of where they're from or whether they're famous or not. And he really focuses on teaching trainees and residents. And I love it. It's such an inspiration for me that in his retirement, he finds time to do this. And he actually said we wrote a paper together about this, about how social media can help pathologists of all ages, not just young people, but older pathologists too. He said that this really changed his life, that in his retirement and at a time where he was actually sick, he was able to get online, and it allowed him to connect with people and find this really fulfilling and enriching opportunity. And I love that. And we wrote this paper before I had ever met him in real life. I just knew him from the internet. And of course, because I read his book all the time. And what was cool is he invited me to speak at his meeting, McKee Derm Conference last year in Kiev. And afterwards, he agreed to let me interview him. And he's just such a wonderful storyteller. He's hilarious. You can check out this video if you want. It's on my YouTube channel. And he's just amazing, just such a legend. And I'm really so honored that I've gotten to know him and spend time with him. We recently went to Egypt together right before the COVID pandemic started. And I would have been in Kiev again at the McKee Derm Conference this year, except it got canceled because of COVID. So in any event, I'm one of his biggest fans. And I think he shows that it doesn't matter. Anyone who says I'm too old to use social media, I point to Philip McKee and say, are you really too old? Because he's doing it and it's amazing. So let's talk about YouTube, because YouTube is something that's been really important for me in the past few years. I started a channel back in, I think, 2012, and I made a couple videos, and it was so much work because I tried to make them perfect, and I kind of gave up on it. And then a couple years ago, one of my students, who's now a resident in at the University of Arkansas, Mickey Lindsay, she said, please make a video about skin histology. So I did, and it became very popular. And from there, I went on to make many videos. I think I'm at 100 and something now, and I've made some videos of pathology cases using Path Presenter, and I've shared all sorts of different interesting cases when people can watch this from around the world. And so even though this is about an esoteric subset of pathology, there are a lot of people worldwide that are interested in seeing this. And you know, I'll point out here that I've got now 1.6 million views of videos, and that adds up to 197,000 hours. And when you look at that, that's 22 calendar years, 22 years of nonstop view time of the videos about pathology that I put on my YouTube channel. And that's incredible. I mean, I've only been in practice 8 years. So YouTube has allowed me to educate more people and in a much more vast way than I ever could possibly have done using traditional teaching techniques. And you know, I hear people all over the world tell me, please make more videos, make videos about non-dermatopathology stuff, but that's all I really do in my practice is bone, soft tissue, and skin. So I can't make videos about GI path or heme path. So I leave it up to all of you out there in the audience. Maybe there's an area you're interested in. Go make some videos about it. Even if you're not a world expert, there's someone out there who wants to learn what you know. Even if you're a resident or someone who's junior, there's always someone that you can teach, and you can pass on what information you know and pass that on to others to help other people learn. And I would like to point out here that India ranks number 2, 11% of all the views on my YouTube channel. So huge shout out to you guys. You're awesome, and I love your support and all the great comments you leave me on my videos. Thank you very much. That's really what keeps me going, is when people tell me this helped me diagnose a case today, or this made it easier for me to understand liposarcoma. That keeps me going. You know, it makes me want to make more videos because I know it's out there making a difference for people. And you know, this is the thing I think that really speaks to me the most. The YouTube analytics will show you how many views you've had for the past 48 hours on your channel. And a couple of years ago, I looked at the screen, and it used to be kind of like this. There'd be some white bars, some hours of the day where people, no video views. But about 2 years ago, there was solid blue bars, all hours, every hour of every day. And I check this every day easily. And I have not seen a white bar on this side for 2 years. So I have people watching these videos 24/7, 365. While I'm giving you this lecture, someone in Africa or Europe or Russia or somewhere else in the world is learning about giant cell tumor of tendon sheath or angiosarcoma because of the videos on my channel. So it allows me to teach even when I'm sleeping, even when I'm playing with my daughters or having dinner with my wife or taking care of my own real life patients in my practice. My videos, I make them once and then they can teach forever automatically because of the magic of YouTube. So it's really powerful to be able to have 5,000 views in the past 48 hours. And that really, as an educator, is so incredibly powerful. So I talked Philip McKee into doing this. About a year ago, he won an award at the American Society of Dermpath meeting for all of the things he's done to contribute to dermatopathology, particularly the work that he's done with social media in his retirement. And I said, Philip, you really need to make videos. It would be so cool for people to hear your thought process as you work through a case. So I brought him to my hotel room. We pulled up his MacBook, and he made a video about nevoid melanoma right there. And then he went back to France, and what did he do? He started his own YouTube channel, and he's got like, I don't know, 30 or 40 videos now. It's incredible. And I feel like this is my greatest contribution to medicine, that I talked Philip McKee into joining YouTube, because that is a treasure for future generations to benefit from. And it's just a wonderful thing to have an expert with, 40 years of experience in dermatopathology give their thought processes and share what they think when they look at a slide. It's really cool. So do you guys get questions like this in India? Because we do here in the United States. People don't really seem to understand what we do as pathologists. Even our medical colleagues a lot of times don't fully understand. And I think social media doesn't totally fix that problem, but it sure can help us to raise awareness and let other people know that what we do matters and it's important, and it's something that's actually relevant to real live patients. And so some of the social media work I've done has been picked up by radio stations, TV stations, podcasts, traditional media, things like NPR. It's a huge honor to have NPR write a story about me. And I love that they picked this image of me and Pembe in Istanbul. Pembe is my Turkish sister. I had met her through social media. And then when I was on a layover for 15 hours in Istanbul, she flew from her home city, Konya, to meet me in Istanbul. And she took me around, hired a tour guide to take us around the city for 4 hours. And my wife was with me too. And she gave us like more gifts than we could carry back onto the plane practically. And then she flew back to her hometown. She just came there to meet me and Jenny, my wife. And she just said, it's just so great to meet you because of what you've done to help pathologists. And I just thought this is like, it's so deeply meaningful to me to know that that's the connection that we have to each other because of social media. And it's beautiful and wonderful. And I'm really happy to have her as a friend. And again, this is just one of countless examples of how very real relationships are that I founded through social media. And then this was really cool for me. BuzzFeed is kind of a slightly, I don't know, it's tailored towards a younger crowd, but BuzzFeed wrote a story about me and I had no idea they were doing this. And I thought that was really funny. And my medical students really liked that actually. And then this is an example. Dr. Kate Miller is a family medicine doctor, a general practitioner from Canada. And she wrote this on Twitter and said, I have to be honest that before Twitter, I rarely thought about pathologists. Major oversight on my part. And I've kept in touch with her and we've both given talks about social media and talked about this kind of interaction and how this raised awareness to other doctors of the importance of pathologists, to see pathologists discussing cases, to realize that we are intelligent and we know a lot about a very, very niche area of medicine that most people can't do. And so I think it's really important to see this and to see that we have this ability to reach our colleagues just by the conversations we're having on Twitter with each other. And then I do patient advocacy, and that has been a really, really powerful and meaningful thing for me. And I could go on and talk about that. This is my friend Pip. She had dermatofibrosarcoma, protuberance on her forehead, and I got to meet her, and I've joined multiple patient groups since, and I help educate them about their disease, and I also learn a lot from them. We also did a research study, and see these 5 people here who are my co-authors. They are patients, DFSP patients. They were co-researchers and helped us design a survey study, which is, to our knowledge, the largest survey study of DFSP patients ever conducted. And through Facebook, we were able to get, hundreds of patient respondents in just a few weeks. It's amazingly powerful to do research through social media. And this was all approved by the IRB ethics board at my institution. And I don't think there's been a prouder moment for me in any of the papers I've published than to have my name published right next to the patients, because who's a more vested researcher than the patient themselves? So it's just a very moving experience to get to partner with these patients in this way. We've also done a survey study of a variety of sarcoma patient groups and other rare tumor patient groups, and we found that the patient groups really like having a pathologist there. They find it useful. They find that it helps them understand their disease, and that overall it's a good thing when pathologists volunteer in patient groups. And I imagine that there's a huge need for this in India, where I'm sure that many people in your population have diseases, don't have good understanding of science or medicine, maybe are not able to speak English well, and you may be able to reach out to those people and help them understand, and it really helps the patients cope with their disease, particularly for patients with rare disease, who may not know anyone else in their whole community who has the same disease as them. And it's a very alienating feeling for patients who have these diseases, and to meet each other and learn from each other and have empathy with each other is really powerful and healing for them. And I love that I get to be a part of that. And it's really changed my life. This is a paper I wrote about this, you can read. And if you're more interested in this, I've got a video explaining some of the basics of how I do this on my YouTube channel. And I had the real great honor of giving a TED Talk about it earlier this year, which was a really wonderful experience for me. So closing up here, I went up for promotion to associate professor back in 2016. And I'm not sure how it works in India, but in the United States at an academic institution, you have to show that you excel in research, that you excel in patient care, in leadership, and also in teaching. So we do surveys of our students and our residents to see how they think we are as teachers. But I thought, I teach online, so why not survey my followers online? And I actually included this information in my official packet to my university, not in place of my traditional metrics, but as additional supplemental information. And I did a survey and I got 1,100 responses from 85 countries in just 4.5 days. And that really blew me away. I couldn't believe so many people would respond and take the time to do that survey. And it was from all over the world. And again, I'll give India a shout out. Second place, you guys, you're awesome and I love it. And it's just really amazing, though, that this is the kind of reach globally that we can have with our social media posts. Because I just posted this on my Twitter and my Facebook and Instagram and asked people, can you please take a minute to do this survey to, help me get promoted? And 99% of people said I was an excellent or good teacher. And there were still 3 people that said I was terrible and very poor. And I don't know what I did wrong to make those people mad, but oh well, I guess you can't please everybody. And in the end, though, impact is more important than metrics. All these numbers are great, and it's a good way for me to convince audiences, especially people that don't use social media or people that are more traditionally minded, that this is powerful, it has impact in the real world, and it's something that we should be doing. It amplifies the work that we're doing in our professional careers. But really, the numbers are just numbers. What really matters is real life impact on people. And when I asked people in that survey, if you're a doctor, have my posts actually helped you diagnose a patient better in real life or care for your own patients better in real life? And of the 762 doctors that took this survey, 681, 89% of them agreed or strongly agreed that my posts helped them care for their patients better in real life. Now that I know that, how could I ever stop doing this when I know that it lets me reach patients far beyond the sphere of my own practice and help people around the world by sharing this information in my spare time to help other people better care for their own patients? I mean, to me, that is the real meaning of it all right there. That's what it's all about. So I think that whatever we're trying to accomplish in our careers, social media does not replace the old ways of doing things. It doesn't replace the traditional stuff, but it lets us do all of it bigger, better, faster, and more powerfully than we could ever do before. So I think it's a perfect partnership to use social media with the traditional ways of our careers. And it's hard to get people to see that and to accept the culture change. Culture change is hard for all of us, but I think this is something that the benefits far outweigh the negatives if you just use some common sense and you go out there with an intent to help and educate others. And so that's my story, and I'll leave it to you to write your own. Thank you very much.
Thank you.
Thank you, Gerard. That was very, very inspiring, and I'm sure everybody is inspired, irrespective of the age. As you said, age is just a number. Okay, we have lot many questions. We'll take the questions later at the end of all 3 sessions. We'll quickly move on to the next speaker, Jairam sir. Over to you.
Yeah, good evening to you all, and it gives me great pleasure to introduce Dr. Cameron Mirza. He is the Associate Professor of Pathology and Laboratory Medicine, Medical Education and Applied Health Sciences, and the Vice Chair of Education, Department of Pathology and Laboratory Medicine, Loyola University Health System. He's the Program Director of the MS degree in Medical Laboratory Science, and his education-related research interests are in the use of social media as a novel pedagogical tool for pathology education. And he's an award-winning educator and mentor. He's the founder of pathellective.com, a modular, free, and interactive website that allows any trainee an organized virtual pathology elective from any location in the world. So this is about Dr. Cameron, and I must admit, I'm very naive when it comes to SoMe and Twitter and Facebook. I've done my bit about trying to educate people with digital pathology and virtual slides. So it's my opportunity to learn a lot from you guys. Dr. Mirza.
Thank you very much. It's a big honor to be here. I thank you very much for that kind introduction. Again, good morning from Chicago and good evening to you guys. And you can see now we're a few thousand miles, maybe more west of Jared, and you can see the sun is now coming up here. And so you can probably appreciate that. I wanted to thank you all, the audience. I have been to India in person myself when I was 16. It was one of the best trips of my life, and I'm looking forward to hopefully coming back in person someday. But I'm very honored for this invitation. I'm also very honored somehow, like I don't understand how I'm going to follow that amazing presentation by Dr. Gardner, my very, very good friend and mentor. And I wanted to add to Jared's talk where he talks about the satisfaction from his career and how it comes from patients and his students. And there's more actually, which he is too humble to admit, and that is that he has numerous people who have mirrored his ability to kind of champion social media. And I'm definitely one of them. And many of the things that I've done, if not all of them on social media, have been inspired by him. So I think that should be an addition to his satisfaction with his career. So my section of the talk, if you haven't already been convinced by Dr. Gardner about how social media can potentially change the way you approach everything, I'm going to be specifically talking about education, and we will talk a little bit about some things that you can all do in your own institutions and in your own departments to kind of bolster education and hopefully even change the perception around pathology and laboratory medicine. So that's the question that I want you all to answer. If Dr. Gardner hasn't already convinced you, I'm going to try and convince you even more, whether we can use social media as a novel pedagogical tool in laboratory and pathology education. And the reason for this is that you have to understand that, when it comes to education, there are ways and means to try and facilitate evaluations, to improve curricula, and it's not the simplicity of Twitter and Facebook and all sorts of social media platforms actually doesn't take away from the fact that you can properly use this as a pedagogical tool. And hopefully we'll show you some data to answer that question. And I think that this entire time frame with COVID-19 definitely underscores the importance of all of these factors, right? Because even before COVID-19, social media had changed the way we were looking at new information, how we were engaging with one another, how we were networking, and most importantly for this part of the talk, how we were educating. And now what we've realized is that while we're missing all of that in-person interaction, but look at us right now, from across thousands of miles and thousands of kilometers, we are interacting and educating one another through virtual means. And that really underscores, what's, the educational power that social media tools have. So in a very simplistic way, right? The first question that we want to answer is, well, are teachers on social media? And the answer is definitely yes. And if not everyone is on it yet, hopefully, a couple of more thousand after your CapCon 20 conference should be on social media, hopefully, fingers crossed. And then the second question, the simplistic question to answer is whether students are on social media. And the answer is yes, everyone can be a student on social media, right? And so, I'm obviously South Asian. We have a very specific kind of thinking about, distractions during educational conferences. And we typically ask everyone to turn off their cell phones, but, times have changed. And it's time now to not turn off your cell phone, right? Because medical education Twitter, all of you listening right now, whether it be Path Twitter or more, you will be taking the message that you're hearing today and you will be promoting it and you will be distributing it. And then, the multifold, kind of impressions that you can get are because we now actually have access to education through our phones all the time, right? So whether it be using social media in university setting, in a research setting, in teaching settings, or in just in a community-based setting, right? There are many numerous free online and freely accessible medical education material that is present on social media platforms. Dr. Gardner already mentioned the Path Twitter community, which really is lab and pathology experts across subspecialties across the globe. Across the globe, there will be things that are super common in India that might not be common at all in the United States, right? And what better way for us to learn from one another than by sharing what is available to us freely, the material, and exchanging it. Dr. Gardner talked about the amazing articles that have come across because of the fact that social media networking actually existed. And now not only are people publishing papers together, but we're also discussing things in journal clubs together, right? These are online journal clubs, and we're talking about papers, talking about the input that other people would probably have, or discussion that we would have around findings that other authors have actually published. Similarly, it's not just about education and distribution, it's also about promoting and acknowledging and applauding educational material. There's hashtag Path Tweet Award, and this is a national award now, amazing, started by Dr. Mukhopadhyay, who Dr. Gardner already introduced to you. And this amazing way of us, patting the back of our colleagues about tweets that they've put forward is an amazing tool that we're putting forward in a way to commend each other. We've already mentioned research collaborations. This exactly right now, this is a national and international conference, and we're live tweeting. People have advanced scholarly activity, and really Twitter homework and Path Elective, the two things that I'm very, very proud of, probably the very small but meaningful thing in my career, which I'll be talking about today, are all efforts that have come out because of social media presence. And all of these things that I'm listing actually are all education, right? Every single thing is a means to educate the people. And this isn't necessarily only in the pathology community. I think that we have one of the most vibrant pathology Twitter communities, when it comes to education, but in multiple other subspecialties of medicine as well, med Twitter is really booming. And I think it's booming more now because of the fact that the pandemic has shut down a lot of in-person events. So, really there are numerous individuals who are talking about the intersection of social media and medical education. And this is a little bit of an old journal from gastroenterology, but it talks about how patients had already flocked to social media sites, right? Like Dr. Gardner was mentioning his Facebook discussion groups. Med Twitter was a little bit slow to catch on to that, but now in 2020, I think that they really parallel one another. And it isn't just about the fact that we're intersecting with the community, it's also within the scientific world, right? It's amazing that we can have the core medical world and the core research world, and we come together. And this is an amazing commentary by Dr. Mehta. And he talks about how the fact that Twitter has burgeoned as a freely available worldwide platform for rapid dissemination of published and unpublished research advances. Jared and I have talked about this quite often. It's CME light. You can just open up, honestly, even if you're in the bathroom, if you have like the phone open, you can take a look at it and you learn something new. As a hematopathologist, I learn things about the blood every single day, and I'm learning them from medical laboratory scientists in the United Kingdom, from hematologists, oncologists who are clinical practitioners, patient-facing practitioners within the United States, and I'm learning things, from my own residents who I meet on a day-to-day basis, but I learn something different and something new in the privacy of my home within a few minutes, because it's just continuing medical education. So like Jared was already mentioning, if it isn't direct access to expert knowledge, if it isn't the broad community that we have, if it isn't the networking opportunities, if it isn't the fact that you have flattened hierarchies where you can, talk to Dr. McKee as if he was sitting right next to you if he answers your direct message, you can use pathology education to enact change, right? So whether if you even ignore all of the networking, the scholarly perceptions, that people have about the wrong perceptions people have about pathology, so you can enact change by really showing the world what pathologists and laboratory medicine or medical scientists do, right? And in that amazing post that Dr. Gardner already shared, where the family medicine practitioner had a completely different view now of pathology and laboratory medicine. So let me give you some examples, right, of how across the globe and how amazing the educational content can be. So on the left is Anas Nasser. He is on Twitter as under the underscore scope. And he's a biomedical scientist in the United Kingdom. I've never met him, but I would consider him one of my Facebook, Twitter friends, in the sense that I love his posts. He has numerous hashtags, that he can work with, but this one is Morphology Monday. I know that Dr. Zhang had started FNA Friday. I've started Hump Day Heme Path, which is on Wednesdays. And so there's so many hashtags that you can follow, and these are all pathology education. On the right is a world-renowned parasite expert, Dr. Bobby Pritt, who goes by the handle Parasite Gal. And she is now, completing this case 580, where she's showing you a Demodex species. I mean, I don't think I would ever see this in my practice, and I'm not sure how endemic or present this is in India, but there are ways to identify, things about this particular parasite, which, I wouldn't have necessarily come across if it wasn't for Twitter. And it doesn't have to be the really unique things, right? On the left, Juliet Smith, who goes by the handle Transfusion Geek, is showing you the normal variation in the straw color of platelets, right? Pool platelets. And so she's just showing us very simple but extremely important feature that, different colors can actually be present when platelets are being pooled. And sometimes it can even have a green appearance, right? And so this image speaks volumes because it shows you what the normal variation can be. And like talking about flattening hierarchies or the accessibility of education, on the right now is an ICCS webinar, which was earlier this year. And Amar Rajab, who's very well known in the flow cytometry circles, was going to be talking about multicolor screening tubes in clinical flow cytometry. The ICCS conference, the national conference, just ended a few days ago, and it was free pretty much for everyone. ASCP's conference was free for all members. I mean, things are changing and education is really at your fingertips. And so the question is, what can we do, right, to ride that wave? There is an energy, a wave of pathology education, and we need to ride it. these are some, I couldn't obviously resist showing you some of my own tweets, which is kind of horrible of me, but these are a little bit old, and maybe leishmaniasis obviously will be much easier seen in India than it was seen in the United States. But when I trained, I didn't see a single case of leishmaniasis, and this was a case that of a child who was visiting from Africa. And honestly, when I was looking at it on the left, I was looking at this and I thought, is this a megakaryocyte, and are those weird platelets? And obviously not. Those are Donovan like leishmania bodies, and it could just be a very nice picture of something that is kind of mundane, right? On the right side, I had a patient known heterozygosity for hemoglobin S, and I saw beautiful hemoglobin C crystals. And so, what? We put it out there thinking that, all right, let's take a look at this and see if other people can kind of answer those questions as well. That scholarship has taken me from being a relatively satisfied individual who teaches at my own institution to somebody who can now teach across multiple different platforms and on multiple different meetings. Here I'm showing you a direct message conversation between July and November of 2019, where a group of laboratory scientists and myself were putting together a submission for a national conference. And in July, on the top is my message in blue, telling them that, all right, we've submitted it. Good luck, fingers crossed. Let's see what happens. And in the November, on the left side, you see that it got accepted. And the four of us gave that panel, and it was about pathology and laboratory medicine. And this entire thing happened on Twitter. I actually had never met. In fact, I've still not met one of the people in real life, like Dr. Gardner has been mentioning as well. And the other two I actually met on Twitter first. So let's talk about education, right? So when we think of education, you think of lectures. Well, you have them on social media, you can have YouTube channels, you can have different sorts of tweets. When you think of education, you think of book chapters, right? Well, you read a chapter. And let me draw your attention to tweetorials, right? Tweetorials are a collection of threaded tweets that are aimed at teaching users who engage with them. And in my way, these are kind of like small paragraphs. They're an extension of the tweet, which would be the baseline information. And a tweetorial would basically extend it into multiple tweets, and you could thread them together and almost read them like a short paragraph or even a short chapter. It can apply multi-level media, right, to support different types of learning styles. Because again, now we're talking about pedagogy, right? And in pedagogy, you have to think of learning styles. You have to think of different types of almost objectives, right? Like, are the students understanding? Are they comprehending? Are they listening? Are they able to, take the objectives to a higher level? But the fact that you can put tweets together in a tweetorial form allows you the ability to look at polls and diagrams and videos and links to different articles, and you can just keep going, right? So you can have something together that is put together in such a fantastic way where all sorts of material from across the world can be put together in an easily identifiable link. I have found so many tutorials I have found interesting, and you know what I do? I actually just send them to myself as a direct message because sometimes I don't have time to read them. But now my own direct messages on Twitter to myself have almost hundreds of tutorials that I could potentially use if I wanted to in a lecture or in a seminar, obviously giving due credit to the people who made them. And that's what I'm going to do right now. One of the most amazing tutorials I can ever find is by Dr. David Steensma. He is a hematologist oncologist, which is a patient-facing kind of a clinician at Dana-Farber Cancer Institute in Harvard, in one of the Harvard hospitals. And he puts out #hematology tweet story, right? Which is his way of calling it a tweetorial. And I just love it. Take a picture of this QR code. It will take you to his first pinned tweet, where all of his tutorials are actually put together as an Excel sheet, which I love. And he, in this particular one, which was December 14th, 2019, he was like, well, it's the holiday spirit time. And so a lot of people, say holly jolly Christmas. And so he started talking about Howell jolly bodies. Now, listen, I'm a hematopathologist, okay? Blood is my passion. And I thought I knew about Howell jolly bodies, and I know a lot about them. But this guy and his tutorial changed the way I view Howell jolly bodies, right? So he talks about these are the Howell jolly bodies, right? And it's not just the fact that, well, they're nuclear remnants and you can see them in patients who have autosplenectomy. This is like really, really deep historical stuff. So this is a picture on the top left of Dr. Howell, of the Howell jolly name, who he was, where this painting is from, how there was another student in, there was a student in his lab called Dr. McLean, who is on the right side, who within his lab actually made heparin, right? So we take a complete turn, and we are now joining Howell Jolly bodies with the founding of heparin, right? And so heparin was actually founded in Howell Jolly's in Dr. Howell's lab, and then and after that graduation of that student, the other things that were happening. And at the same time, he talks about in France, there was Dr. Justin Marie Joly, who is on the bottom left here. And Dr. Justin Marie Joly was publishing the finding of Howell Jolly bodies a few years just after Dr. Howell had done, right? And so this led to the fact, and they did multiple other things, but this led to the fact that there are increasing kind of descriptions of this, that, for example, Mehdi Tawasoli and William Crosby actually wrote Howell Jolly bodies in the 20th century. They talked about them, and they were attributed to the original describers, right? And now he talks about the fact that these are nuclear remnants. He talks about the fact that they are how the extrusion of the nucleus actually happens in hematopoiesis. He talks about different types of red blood cell shapes and sizes, and splenectomies and autosplenectomies. And then he says, well, if you want to learn more about Howell Jolly bodies, this is an emeritus professor on the right, Dr. David Sears and Mark Uden's article on the history of Howell Jolly bodies. I mean, that's amazing. This entire thread took me through Howell Jolly bodies in a way that I would have never been able to know myself. I would have probably if I really searched hard. But this is available free for everyone, right? Credit to Dr. Steensma. Now, if I want to talk about Howell Jolly bodies with my students, I can take it to the next level, right? So completely the next level. And with education, you have to tie in scholarship. You have to consider scholarship. Dr. Gardner mentioned promotion. There's more, right now I know Dr. Jared Gardner is on editorial boards himself. I recently became the social media editor of a journal. There are many journals now that have social media editors, and this is the way of the future. I feel like if journals don't know, the impact of how much social media can do to their journal articles and the reading and the alt metrics, then they're really, to be honest with you, lagging behind. Recognition for education is one of the biggest and the best, commendations we can get from our students. And as I've mentioned already, Path Tweet Award is there, right? So you can post tweets, you can post tweetorials, you can do them in a way where you can almost structure them with a curriculum. Then you can use them for scholarship, and then you can also use them for getting awards, right? So here's the Path Tweet Award, and it's across the country, right? Brian Cox might not know Kevin Kwan at all, right? But he has now said to the whole world, hey guys, Path Tweet Award to Kevin Kwan. I think that this was an amazing tweet. I also have to give a shout out to Dr. Hermelan, because some of the slides are adapted from an original talk that she gave. And here she uses the, hashtags for tweeting. She's at St. Louis University, and she uses hashtag SLU, SOMP, SOM, Path 2020, which is basically her course that she's talking about, Introduction to Pathology at SLU. And she uses the hashtag. She probably has metrics for it. She's a fantastic educator in blood bank, and she uses the hashtag called Blooducation. And I can tell you that just the fact that she's showing you these antibody titers or these antibody pages, she is fantastic, and one of our faculty members on Path Elective, which I'll be talking about. Dr. Gardner already mentioned this. But to me, even though I have nowhere close to Dr. Gardner's followers, right, the same number, but look at this, like even if 83 people liked this tweet, right, where the question was, well, are these cells APL cells or not, right? Would you start ATRA or not? Look at the number of views. I mean, it's pretty amazing. This was, within a few days, the 20,000 people looked at this, and they might have learned something about APL. They might have learned something about the cytogenetics. They might have learned something about the therapy. Different types of people interacted. They could have been biomedical scientists or medical laboratory scientists. They could be technicians, technologists, people who look at just morphology, people who do cytogenetics, people who do molecular genetics, and people who directly treat patients. All of them had access to this educational material. So education you can take forward, obviously in meetings. So this is a recent tweet by Archana Bhatt, and she's tweeting about CapCon. These are her amazing artworks. And, I don't know Archana, I just thought that these were really beautiful. And please go vote for your favorite artworks, which is obviously part of CapCon. I mentioned journal clubs. I know that Dr. Gardner was heavily involved with Path Journal Club and Derm Path Journal Club. We recently started HemePath Journal Club, and again, every month there is a discussion of a fantastic article on hematopathology. It delves into details which we would have never really come up with, discussing just if we were talking about it alone in the privacy of our homes. And now clinicians are joining us, the authors of the journals are joining us, and they're talking about their experience, and hopefully we'll be able to inspire other people as well. There are numerous educational opportunities by just Twitter chats. You can talk about Twitter chats in a way. We are recently doing a lot of Twitter chats for the incumbent pathology residency applicants, right? Because everything is online. And so we have a path to path chat. The College of American Pathologists does a CAP chat. Here I'm showing you an example of medical laboratory scientists talking about particular issues, and that's MedLab chat. And you in India, anyone in Africa, anyone in Russia can follow along and be part of the conversation. And if it isn't like something very fantastic, like an educational opportunity, you can do fantastic things such as path art. It's something very close to me. This is Pseudo Mona Lisa, which was made very proudly and within our department here at Loyola University Chicago, the microbiology department. And I love this, how they plated the Pseudomonas. And yep, that won first prize in our art competition a few years ago. I have to tell you, with the world changing and how our marketing and how our publicity about different departments and different programs is concerned, it is actually imperative for programs now to be on social media. And you'll be surprised, actually, if you just look at the number of pathology programs that are on, residency programs from the United States that are on. They have skyrocketed. Every day I'm seeing that there are newer programs that are, old programs that are coming up with new Twitter accounts. And good for them. Everybody should be able to flaunt what they have, talk about their strengths, talk about what they have to offer for candidates, because everything is going to be virtual. I'm showing you a picture here of a program that I started at the Loyola University Chicago. It's a master's degree program in medical lab sciences, and we have a Twitter account. We don't have that many followers, but we're slowly growing and expanding. And I hope that if people come to those social media pages, that they will learn more about our programs and hopefully apply to our programs. So here I like to take a pause and change direction and talk about kind of, the last few slides we'll be dealing with how I use social media specifically to change the way I educate. And what I found in my department was the fact that when pathology elective students come, first of all, not that many people do electives, but when they do pathology electives, they don't know that much. And when they come, they spend time sitting at the scope, etc., and doing all of these things. And what I wanted to do was to show them somehow that they have an ability to teach or learn even outside the regular days. So this QR code takes you to the pathologist article about Twitter homework. Basically, students just had to create a Twitter account and tweet or retweet only one pathology-related thing every day, made sure that it was compliant with patient safety and patient privacy standards, to credit all original sources of information, tag it with me and Twitter homework and path elective so I can find it, and then to enjoy themselves. And I told them that this isn't compulsory and it does not affect their grade. And the students did so well. They posted about things that they were doing. This was whether it was microbiology, whether it was their own blood grouping, whether it was complicated things like that they hadn't understood about platelet aggregation. And we asked them certain questions. We asked them questions about whether, for example, what they learned during their pathology elective will be useful for their career. And the students who used Twitter, 80% of them strongly agreed with this. And the people who did not use it, there were only 34% who agreed with that statement. We asked them whether they had a Twitter account before or not. And what we found was that if you already had a Twitter account, people were more keen and more interested in actually participating because they didn't have the inertia of using Twitter. But the interesting question on the right is that before their elective, what was their baseline awareness about pathology-related educational resources on Twitter? And 65 to 67% of them said that they weren't aware of it at all. And this elective opened their eyes to the fact that Path Twitter exists. And if you look at the top right, the people who use Twitter, 82% of them said that Twitter homework by itself increased their medical knowledge. 82%. That's a pretty high number, right? They all agreed that it exposed them to reliable educational material. Most of them felt that it was not a burden at all to use Twitter during their rotation, and most of them felt that it did not take away from other educational activities. In fact, if you look at the 82% of people who answered the question, could it be useful for future students to increase their knowledge about the role of pathology and lab pathologists? All of the students who use Twitter said yes, 82% said yes, and almost actually 60% of those who didn't even use it, they saw their friends using it and they said yes. So they didn't have an adverse experience. They only posted usually once, and it changed their perception of pathologists. I think that that's really, really powerful. We had 37 students, and in their 527 tweets, there were 78,000 impressions. But then that was retweeted 810 times. 810 students retweeted it almost 3,300 times. That led to more than 6 million impressions. That's insane. Look at that. Very proud of India. You're one of the highest, right, retweeters of Pathology, of Twitter homework. The numbers, this is just a snapshot from a month. This is pretty amazing. These are just a couple of students a month who are creating all of this extremely amazing content. And and I'm running out of time, but I wanted to talk about the fact that you can do this, right? This is a hashtag called Path Rhymes. This is a stupid little rhyme I made up, and it talks about a particular type of molar red cell, right? I mean, people loved it. 151 likes. We started hashtag hallway path quiz. This is literally a picture of a board, which if I turn my computer, it's like right outside my door. And every morning, one of our residents would put this question on, and now this has become a separate account, a separate Twitter account. Please follow it, hallway path quiz. One of the most amazing things that came out of this was the fact that pathology elective was created. And this I credit completely to social media and education. So please go to www.pathollective.com. This is a free website that has been founded by a couple of amazing individuals. You'll obviously recognize Dr. Gardner. And we co-founded this together. This fantastic resource now has free modules. Students from across the world, whatever their background, they can click into anatomic pathology modules, and there's some listed here. They can click into clinical pathology modules, and basically this was started in July. This is an example. This is Dr. Arnold, Dr. Maloney, and Dr. McKay's module on pediatric pathology. If you talk about pedagogy, you have a course description, you have, ways that it will help you, what you're supposed to go through. There is a video message from the course director, and in this particular module, there are 3 lessons, tumors, placental pathology, and Hirschsprung's disease. Then if you look at pediatric tumors, everyone will have objectives. It will have a to-do list. You will go through a series of videos and questions and do some cases. And there's an amazing plug to the next talk, which is, the amazing path presenter is part of this as well, which we'll be learning about from Dr. Singh. And in the end, you can get a certificate. It automatically comes if you pass the course, right? And so here I just gave a certificate to CAPCON 20, which congratulations to all of the presenters. But this is a pretty amazing tool, right? Path Elective started in July, and 27.8 thousand unique visitors have already happened with 182,000 views. These numbers, you can see that in July there was a peak, but even if you look at weekly numbers, around 1,000 people visit the website every week, which is amazing. Right, the highest is obviously to the homepage, but we have data now about how many people go into the separate modules. And even the lowest one right here is the heme path, where over 3,000 people have visited it. And again, a big thumbs up to India. It's one of the highest number of people who are coming. Hopefully this will only get higher and higher, and people will learn more. So Dr. Gardner already mentioned this, does this really, all of this teaching, does it help you grow professionally? And now many institutions are taking criteria for in their promotion guidelines that include social media promotion as well, the social media portfolios. And while this is happening slowly, I think that this will be very, very important, as Dr. Gardner was a great example of this already, about the reach and how it should be used. So I leave you with this. This is from Mayo Clinic, that on Twitter, don't lie, don't pry, don't cheat, can't delete, don't steal, don't reveal. All right. And with that, I will end my part of the conversation, and I will hand it over to the next speaker.
Thank you very much, Dr. Mirza. That was very informative. At least I learned a lot. Starting on a clean plate, I think I filled in a lot of information into my mind. Thank you.
My pleasure.
Vijay?
Yeah, Dr. Rajendra Singh is professor, departments of pathology and anatomic pathology and laboratory medicine, Zeko School of Medicine at Hofstra, Northwell and Northwell Health. He serves as director of dermatopathology and associate chair of digital pathology. After his education in India, Dr. Singh trained in anatomic pathology and at Wayne State Medical Center and completed his fellowship in dermatopathology at the MD Anderson Cancer Center. Prior to joining Northwell, Dr. Singh also had held faculty appointments at the University of Pittsburgh Medical Center and Mount Sinai Hospital. Dr. Singh is the creator of multiple online teaching tools and platforms, including MyDerm Path Plus app, Videx.com, and Path Presenter, and is internationally recognized for his contributions to education in dermatopathology. He has won several awards for teaching excellence on multiple occasions at Mount Sinai. He is an editorial board member of for the WHO classification of tumors, 5th edition that is. Most recently, Dr. Singh was selected to the board of the Digital Pathology Association. Dr. Singh's teaching and research activities are complemented by his many administrative leadership positions nationally and internationally. I personally had the opportunity to interact with Dr. Singh a year ago. I'm happy that Singh is here. Over to you, Dr. Raj.
Thank you, Vijay. Thank you, Aditya, for all the hard work that you have put into this building this platform and like building this spectacular like array of people that have come to speak at your meeting. And Dr. Jared and Cameron actually really did a spectacular job, and so we'll try to follow it up with how do you. So now at least I think you guys are completely convinced that social media is definitely something very, very important for not only for your for learning and teaching of pathology, but also for your career. So it will help you create win-win situations. So I think as soon as this lecture ends, you should all like start thinking, how do I now follow the path that Jared and Cameron has shown us? Basically, how do we follow that path? So like joining joining Twitter, joining Facebook is very easy. Like, but once you join these mediums, how do you use those mediums to actually now promote yourself or to learn pathology, to teach pathology? So I'm going to talk about how do you actually do that. So let's go to. So my topic, so you can see my screen, the presentation.
Yes.
You can see this, yeah, okay. So my topic is going to be how do you use now social media, because I think you're pretty convinced that you can use social media for enhancing pathology education and your careers. So very effective, that will help your career, but you also have to be careful of what you post, because it can also destroy your career actually. So be very careful of what you post. There's like the last slide that Cameron showed, where don't steal, don't reveal. So be very careful about not showing any patient information. And if you are using information from somebody, like always acknowledge. That is very, very helpful actually. It will help you in promotion, it will help you in learning, and also sharing the data with millions of people around the world. And now because of digital pathology, it's much bigger, it's become much easier, because previously you used to have you would have to take a snapshot from your microscope, bring that snapshot onto social media, and then share that snapshot. But with digital pathology, because the slides are digitized, everything is available on the computer, sharing is very, very easy actually. And it doesn't depend on what media you use. You can use YouTube videos, you can use Facebook, Instagram, LinkedIn, Twitter, Snapchat. Just start using any of these media, and then you can see where you can make the most impact and where it helps you most, and then jump onto those media. So now the topic of what I'm going to present is how do you use it actually? How do you start using social media? So what we have built on Path Presenter that you guys are most likely aware of is multiple tools and to use on social media. And you might say that you don't have any scanners in the department, you don't have access to digital slides, but I don't think that is an excuse anymore, because you don't need a scanner, you don't need a digital slide, because there are already thousands of vetted slides available online, which you can start using any day. So you can start to learn pathology, you can start to teach pathology, share images, collaborate with people like Jared said. You can connect with anybody around the world and stay up to date. And the proof in the pudding is the number of people that use these media, the system, the platform every day actually. So if you look at There are more than 150,000 plus users that have like visited the platform. More than it's like crossed already 1.5 million. The number of countries, it is 173. And very interesting is this COVID peak actually. So like previously there used to be 500 to 1,000 people coming to the platform every day, and now with COVID there are days when it crosses the 4,000 mark actually. So like people are visiting, using the platform every day. So you should be also using this platform to learn pathology, teach pathology, and spread the knowledge around. And multiple institutions around the world are actually using the system for their internal teaching and external teaching. So including the WHO that has the blue books on their on the system, Sloan Kettering, the NHS, Boston University, University of Chicago, Ohio State, and even like organizations like the American Academy of Dermatology or the International Association of Cytology, and institutions in Japan, institutions in Australia. So everybody is finding some way to use the platform. So you should also jump on basically. So what does the how do you use the platform in social media? So there are multiple tools here that you can see here that you can start using. So we'll go through how to use these tools to on social media to teach and learn pathology. So the My Slide box that you see, the first box here, the My Slide box here, allows you to upload any kind of files that you have. Basically, it could be just digital files, it could be a radiology DICOM image, it could be PDFs, it could be MP4 videos, JPEGs, TIFFs, whatever kind of file you have, you can upload and share with the world. And sharing is very easy. I'm going to show you a demo immediately after this slide. And when you are sharing, no login is necessary actually. So let's go and look at a demo of how do you use the My Slide box. So it's a free registration. Once you register, when you go to the My Slide box, you can like create folders and subfolders here, and then you can upload any kind of digital slide, DICOM image, JPEG images into the system. And if you want to share this image with the world, all you need to do is once it is uploaded here, you can either share an entire folder, you can share multiple slides, or you just click on the share button. You can send a QR code, you can copy the link, and I'm going to put this link in the chat box. I don't know where the chat. So like if you like, I don't see the chat box here, but let's go back to the presentation. You just copy this link and like I'm going to paste this link here, and immediately the slide would open up. So like if you put this link on Twitter, if you put this link on Facebook, if you put this link on any other social media, it's going to open up the slide actually. You can also download a QR code, and the QR code could be put into a PowerPoint presentation that you want to share with the world. You could put it on in a book, in a journal article. You could put it in a book chapter. You could put it on your posters which you are presenting at mediums, and anybody who scans this QR code would be able to open the slide basically. And if it is a pathology slide, if it is a DICOM image, everything is going to open up with just one click. You don't have to download any kind of softwares. It will open up DICOM images. It will open up any kind of pathology images. If you just want to get images of your slides, you can also like just go into the system. You go, let's say you want to post something about lobomycosis. So you just go into the slide library, you find a slide of lobomycosis. And you can either share the entire slide if you want by clicking on the share button that you see here, or you could just go into the slide into whatever image you want to show. Like if you want to show these organisms here that you see here, you can just click on the Snapchat button here, and it will download a image that you can then put on social media. So this camera icon that you see here, if you click on the camera icon, it will help you download it. It will just take a snapshot, and then you can then download either as a PNG, JPEG, or TIFF, and then put that on social media. So either you can share screenshots, or you can share entire slides that you would want to use for either teaching of pathology or learning of pathology, and there are like 30,000 slides in the slide library. So there is no excuse that I don't have access to slides. These are easily available. You just log in, and these slides are arranged in different organ systems. So each organ system has thousands of slides here basically, and they are all vetted. So if you click on neuro, you'll see like thousands of slides on neuropathology here that you can just go and use for teaching or presenting on social media. Now, how do you, like, you have your slides in the My Slide box that you could use. You have the slides in the slide library. Now, how do you use them for creating a presentation that you could then use on social media? So very easy. You just go into the My Presentation tool. You say, I want to create a presentation, and you just give it a name. And then you can import any slides that you want from the library or from your own slide box actually. So if you select like multiple files from the library or your slide box, I'm just going to pick a few here. And you would have all these slides here. You can drag and drop and put them in whatever order you want. And then you just share this with the world basically. Just click on share presentation. You copy the link, and you can then send the link to anybody on Twitter, on Facebook, and people would then get access to these slides. They don't even have to log in. They would have access to these slides. And you can start, you can also, when you can create a video if you want to create a video of your slides. So when you open this system up, you can make this full screen. And if you click on this video icon, it would actually capture your screen and capture your voice, and then download that as an MP4. So let's say if I'm teaching that this is a slide that shows you this and that, then you can just download that MP4 and put it on social media, and that would give you an MP4 that can go on YouTube, that people can then go and look at and learn from whatever you put in there actually. You can also like mark specific areas on the slide if you want to annotate these slides. So you can just go onto these slides when you're building a presentation, and you can actually, like, many people use this to like ask questions. So let's say you are sharing this with a medical school student actually. You could then actually put a box here and say, what is this actually? What do you think this is? What do you think this is? What do you think? Or what is this? Whatever you put it here. And then when you are actually presenting either on social media or you're building a video, when you come to that, so the right click will help you move between the slides. So this is the slide that we annotated. And if I just click on the down key, it would actually go to that specific area, and then you could specifically let the audience answer that question. What do you think actually? So you can use all this info, like all these tools that you see here, for creating presentations. The presentation will allow you to share these slides with the entire world, so they can actually preview the slides. Then you can actually do like a Zoom meeting and present these slides to the world, so they would be able to review the slides with you. And then after you have done with the presentation, you can again share your presentation with the people, and they would be able to post review. So it's a review. It's a preview, then review and post review of the slides. That makes it a very, very powerful way of teaching and learning pathology. Going back to our presentation. So the My Presentation allows you to create presentations with only slides, or you can add PowerPoints to the slide. You can add DICOM files. You can add MP4 videos. You can compare the slides side by side. You can add annotations, and then it will allow you to preview, review, and post review your slides basically. There is an assessment module that is a very powerful way of teaching on social media. So if you can create an assessment which could be like a question of the day, question of the week, question of the month, it could be case of the day, whatever you want to call it, and you could post it every day, every week, or every month. And then for bigger meetings, you can also use the assessment module to provide CME certifications. So I'm going to very quickly demo to you how to create an assessment here that you could put out on social media. So you go to the assessment module, you say I want to create an assessment, and this would be like case of the week, Capcom, and it could just be like, I'm going to talk about lymphomas, And I'm just going to create one question because this is case of the week. Create, and then you just add your question here. Basically, you add the question here. What is the diagnosis? You can then add an image from the library. And then put in options basically. So A, and then you can also put in explanations that people can see. And then once this is created, you just post it on social media, like the way you did it, like so you once it is created, I'm just going to go one that is already created. So DOM path potpourri that we already created, you're just going to, sorry. Again, like you just click on the share assessment and then copy the link and then you put it on social media and people would then be able to come and do that. So when they click on that link, this is what they're going to see and they can start the assessment. And this would actually give them a digital slide with all the options and the answers. And once they finish, they would be able to see your explanations. So a very, very powerful way of sharing information around the world actually. So the group chat is another very powerful tool that you can use on the platform that will allow you to do like a interactive teaching session on the cloud. So you form your groups. You can create a group here that could be like a Capcom group. Then you add the members to that group and so you add your members, and once you've added the members, you can then start adding slides. So if let's say I add somebody here. So they would be able to now add slides here. So now you can just add slides here. So I'm going to add slides. And then these slides can be like annotated, like you can ask questions like, what is this actually? So if I want to ask a slide like to the entire audience, to my entire group, what do you think? Save. And they would all get a question. They will all see it like a question here that you see here. So when they log in, they would actually see it like a question here. What do you think? And if they click on this, what do you think? It would actually zoom into the slide and show them the question that you're asking, and they could respond back basically. And immediately the entire group is then going to see the answer basically. So it's like an interactive way of like discussing cases on the cloud basically. So it gives you a very, very powerful way of interacting and like discussing cases on the cloud. And then like there are multiple other tools that we already have, like other resources that you can use. You can use the publication website, that is the publication.pathpresenter, where there are multiple books that have been created for you to use for teaching and learning of pathology. The conference module will allow you to like create internal and external conferences. The AI module will allow you to share data for research. The other resources that are very, very useful that we have seen many people use is the one that has been created by Vijay, that is ilovepathology.com, which you can easily, like, it's a free access and there's so much information there that you could use. Cameron already talked about the Path Elective, that is a very amazing resource, like just like started off and already like thousands of users around the world finding it very, very useful and using it all around the world. So the take home message is like there is really no excuse to not become part of the world platform, because everything is available at your fingertips. You have your phones, you have platforms like Path Electives, Path Presenter, I Love Pathology, which provide you with the tools as well as the digital slides, images, everything that you want to start today to get involved with learning and teaching of pathology. Sometimes the barriers that you might see that all of this needs a good internet connection, as social media and digital pathology need a very good connection. But with talk of 5G now, hopefully this will not be a bottleneck anymore. So join the network and the new world of learning. That is my the take-home message. And here are some amazing examples of how people use the systems basically. So here you can see the teacher presenting the slide on the screen, and all the students have the slides on their phones also, so they are able to follow the teacher as they are presenting on the screen, and they do not even have to be in the room. Actually, they might be sitting at home, they might be sitting in the library, and they would be able to follow this whole thing. You can see like 300 people trying to in the same room following the same slide. So you're not restricted by numbers or place. You can now just start using digital pathology for enhancing education anywhere, anytime in the world. And you have to adapt to the new technology, because this is a very important quote, that it is not the strongest of the species that survive, but the ones that are most responsive to change. So you have to be responsive to this change. The digital pathology is a very powerful tool. It is here to stay. You can use it to provide second opinions. You can use it to get a second opinion. You can use it to learn pathology, to teach pathology. Everything is possible through social media. Hopefully that gives you a good way to start as soon as the meeting is ending today, actually. Thank you for your time.
Yeah, thanks. Thank you, Dr. Raj, and thanks, Dr. Gerard, Dr. Cameron, and Dr. Raj for coming out with such wonderful presentations. I have lots of questions. I don't know if I can handle all those questions. Let me start with Dr. Gerard. What if somebody says, I'm busy and I don't have time for all these things? And what's your message for that?
Well, it's a fair point to wonder about time. We're all busy, right? But I mean, I'm a relatively busy person. I have 3 young kids. My wife's a doctor, and a pretty busy practice. Hey, one of you guys, could you mute your mic? I don't know who it is. I just hear echo, and it distracts me. I'm sorry. Okay. Thank you so much. But I think that, I spend a lot of time every day, or most days, doing social media, but not everyone has to do that, right? This is a big chunk of my career, a big subset, a niche area that I publish about, I speak about, and so I spend a lot of time doing it. But I think that to be successful with social media, I mean, 10 or 15 minutes a day, and not every day even, is plenty to get something. And I find it's a useful thing to do at the end of the day when I'm tired and I can't really sit down and write a good paper. At least for me, I do my best mental, creative work in the morning, early morning. So at the end of the day, I've been making decisions all day on my scope about whether people have cancer. I can't do something creative, but I can scroll through Twitter and click retweet a few times and learn about some new thing like Howell Jolie bodies or whatever, right? So I think it's a perfect thing to fill those little bits of downtime where you wouldn't be getting anything else productive done anyway. Or in the old days before COVID, when I used to travel, I would do a lot of Twitter when I was sitting at airports waiting, or when I was in hotel rooms and I wasn't with my family. That was time I would use social media more. When I'm busy, or when I'm with my family, when I've got a paper to write, I put the phone down and I do my work. So I think everyone can find a way to fit it into their life and their schedule. It's I don't know. I'm a pretty busy guy, and I found a way to do it. So I think that anyone can probably do it.
Okay, that answers the question, Dr. Gerard. Continuing with that question, I have another question from Dr. Ravi Kumar. He says, social media and pathology without regulation is distraction, isn't it? Don't you think so? There are so much content on social media that we don't know whether it is correct or not, and what to do when it comes to that type of scenario. Cameron?
So I think that that's a very valid point, especially with the fact that people can have thousands and thousands of followers. So there are ways to curate that, though. You can do it in multiple ways. One way that I found that a lot of people do it is that they don't actually follow.
I'm sorry to interrupt. Is there an echo, Dr. Aditya?
Yes, I think there is. Perhaps if we muted everybody else, maybe. All right. Yep. Okay,
Yeah.
perfect response. Thank you so much. Thank you. So yeah, I was saying that, there are two ways that you can do it. I mean, for example, I'm most interested in hematopathology content, but that doesn't mean that I'm not interested in other types of pathology content. However, the question is really valid that sometimes it can overwhelm you, right? There's so much information. So there are polite ways of, muting people or, not making, kind of curating your content, your feed in such a way that, you only see the data or the information that you want to see. Other people also do it in a different way. For example, if you produce a lot of material, then it might be relevant for your particular feed to not have that many, don't follow that many accounts, and you can have a lot of people follow you, right? And so it really depends on how you want to curate it. And as far as incorrect information is concerned, that is a real issue. But what I found anecdotally now is that the biggest and the best and probably the most strong peer review is social media. If you put something out there, and it is wrong, people will shred you apart. Like, they're not going to hold back. And so I have found that it's very unlikely that you will end up finding information which is incorrect, because you will almost always immediately be able to find that there will be somebody who has either corrected it politely, or if, even if it's a disagreement, even if it is a plus or a minus, this disagreement I think would be resolved on social media, and people have been able to do it pretty nicely, I would say. They've been able to be very respectful in their conversations so far. I know that there's a dark side to social media. I'm very fortunate that I haven't fallen into that trap yet. But I think that if you curate your feed, and if you make sure that you are just following the proper accounts with the proper information, you should be okay.
Thank you, Cameron. That answers that question. I'll quickly move on to Dr. Raj now. I request all others to unmute yourself. Dr. Raj, Dr. Padmapriya asks, can we use the images to create a folder and discuss with our residents at present? Is it completely free?
Yeah, it's completely free. If you're using the system, there is no cost involved unless you are planning to upload a lot of slides of your own. But it is very easy to go into my presentations and create a presentation which is essentially a folder. And within that folder, you can then add any amount of digital slides. You can also add PowerPoint images if you need to add them, and like you would drag and drop in a PowerPoint, you can put the digital slides in between those PowerPoint slides, and then present using that presentation tool. You could even send that presentation to all the attendees before they join your review course actually. And a very good example is the one that Jared and I did actually. Jared and I did a 100-slide review of dermatopathology. That in the room we had around 20 people that were attending that presentation, and we presented for 4.5 hours basically to those 20 people. But then when it went on social media and that whole thing was put on social media, I think, Jared, how many 70,000? How many views has it got as of now?
It's over 60,000 views of that video in the past 2 years, and it's I think the third most viewed video on a regular basis on my channel. It's long. We wondered, will people listen to a 4-hour-long video? Yep, they will. And then I've recently started cutting out individual small bits about each entity and releasing those, because I think stuff gets buried in there and sometimes people won't find it. So I'm trying to, repurpose that content, and people are watching those and learning from it. I use Path Presenter all the time when I give lectures. Like, I'm going to give one at Loyola at Cameron Mirza's university in a couple weeks, and I'll send Path Presenter slides ahead of time for his residents to review, and then I speak with them virtually and we talk about the cases. So it's a great tool. I mean, I use it all the time for teaching. It's fantastic.
So the content in Path Presenter can be used as a good, the tool for assessment, is it? So continuing with the same question, I have another question, Dr. Raj. We acknowledge Path Presenter and share with others. Is it ethical? Can I use the content in Path Presenter and then share with others? So what are the ethical issues with that?
Because whatever you are seeing on Path Presenter has been shared with the world, like people from around the world, basically. So and when they are sharing it on Path Presenter, they want other people to use it for their education and sharing needs, basically. So if you acknowledge, well and good, but if you don't even acknowledge, the main goal is to help provide people access to good content and training material, and that is the entire underlying principle of building Path Presenter. So If you acknowledge, well and good. If you don't, please go ahead and still use the content as you like it, basically.
That's really good, Dr. Raj. And continuing with the similar question to Dr. Gerard, Vandita Singh asks, what are the medical legal implications while using social media for pathology? In India, there are no laws related to this. And what's your comments on that?
I'm so glad that you asked. Hold on, let me pull my presentation back up. I have, this question comes up almost every time I give a lecture about social media, and I've given like, I think 90 lectures about social media now. So I've written 2 papers about this, about the ethics and then also the legal issues. This one is in the AMA Journal of Ethics, and I wrote it with the amazing Dr. Genevieve Crane. She's on Twitter. You should definitely follow her. She's a hematopathologist, and she was a fellow at Johns Hopkins at the time. And we wrote this about ideas for how to share pathology images online in a way that's ethical and protects patient privacy. And here in the United States, we have a law called HIPAA that legally protects patients. But we feel that following the law is important, but we need to the law is just a law, right? The more important thing is the ethical principle of patient privacy and their right to privacy. So there are ways to share images that are safe, and this will tell you all about how to do that practically. And then also, about a year or so, or maybe 2 years ago, I published this paper with Dr. Tim Allen. And Tim Allen is a pathologist who is a medical doctor, but also a lawyer. He has a lawyer JD degree. So he really understands the law. And we talked about ethics, but also we talked about the legal implications. And I'm not familiar with the case law legally in India, but our understanding, what we basically, our take home is this, that in the US and UK, and we were not able to find any reason that it's not ethically or legally okay. It's legally and ethically okay to share de-identified gross and microscopic pathology images. And again, both of those papers I just mentioned will tell you, and they're both available free online, one at AMA Journal of Ethics and the other at Archives of Pathology and Laboratory Medicine on their website. And we were not able to find anybody who got into any legal trouble for sharing de-identified medical pictures, as long as the pictures were de-identified and used for teaching, for educational purposes. So to our knowledge, there's no legal action in at least in the English case law in the US and the UK. And that's not just pathology images, that's any medical images. We couldn't find any time where someone got legally in trouble for sharing medical pictures if they de-identified it and they were doing it for teaching. So I do think, though, one important thing is that every institution where you work, where you're employed, they may have specific rules, and you do have to follow your employer's rules, even if you don't agree with them, even if the law says something's okay, but your employer says no. You have to follow your employer's rules, or you could, get in trouble. And the other general rule is I've always tried to make my employer, the hospital or university where I work, I've always tried to make them look good online. Don't say bad things about your boss or your employer. It's stupid. You're going to get in trouble. You'll get fired. Don't do that. Just be nice and be good and protect privacy and be polite. And with that, you can, I've stayed out of trouble all these years, and I'm a person who doesn't have a good filter. I say lots of stupid things, and I've still managed to mostly stay out of trouble online. So if I can do it, I know that you can do it too.
How do you tackle this? For example, if you're working in a medical school or if you're working in a laboratory and you want to share an interesting gross image, of course, that would be de-identified image. So do you have to ask permission?
No, I do not. I'm a fan of, I do not ask permission, and I do not tell anyone where my images come from unless someone specifically has shared it with me, right? And for the sake of sharing. But I have down here, I've got boxes and boxes of glass slides that I've collected from all over the world. People have donated them to me. I've collected them at various places I've worked and trained. And those slides are part of my de-identified teaching archive. So I take pictures or scan slides from there, put them on Path Presenter, put them online. And then I never say where it came from, what institution it came from. I always change the age or things like that. I never say, oh, look, I saw this case today. So there's no way that anyone could look at any of the images and know even what institution it's from, let alone what patient it's from. I mean, honestly, I can't even remember sometimes where I got it, when I took a picture or what case I took it from, unless I wrote down. So I think that's the way I do it, is that if you work somewhere, you probably all have slide sets that may have come from a lot of places. So I just go out of my way to not ever say that this came from my hospital or anywhere else. I say this comes from my teaching archive. And it doesn't matter if it's a recut slide that I put in the archive yesterday or 10 years ago. And so that's how I've avoided issues. And the hospitals where I've worked have seen me post all these cases and never had any problem, and they've applauded me for the work that I've done online. So I think that's how I've worked around that problem.
Okay, thank you, Dr. Gerard. Now, question to Dr. Kamran. Asba says, when we share a beautifully captured picture of a tumor, okay, and then we post it saying how beautiful it is, and then immediately there is another comment, how can someone's cancer be beautiful to you? Now, how do you handle such comments?
So that's a very good question, Asma. So that is a very tricky thing to navigate. I typically, it's a tough one, right? So we all understand, like, you can always preface it by saying that naturally, this is a comment or an adjective just for the image, right? I have on occasion used terms like that. I've said this is a beautiful example or a classic picture of something, and absolutely that has the potential to hurt someone, right. or offend someone who's, for example, family member is suffering from that disease, and and they're very emotional about it at that particular time. And so, but I think that you can curate it in such a way that it doesn't hurt people, right? You can almost always, without saying the word beautiful, or you can use things like, this is a very classic example of something, right? And so people will be like, okay, this is a classic example. It isn't necessarily a beautiful picture. There's similar, I've heard similar kind of issues with us using pathology as art, right? How can this be art? This isn't art. This is somebody's disease. But as microscopists or morphologists, we do find certain things very, very beautiful, and they're quite aggressive and horrible diseases. And so I think that within the right communities, within the right followings, you can absolutely use those terminologies. I have on many occasions said those words during sign out with my residents and fellows, because I know that they totally understand what I mean. I'm not trying to hurt anybody, but yes, there is a very real possibility that people might be upset if you call something too beautiful. Take it with a pinch of salt. I always try and imagine from the other person's perspective. Maybe it's like something very close to them, and you can always find an adjective that I think can convey what you want to say without necessarily making it sound like beautiful.
Thank you. That answers the question. Now, Suraksha has a question to Gerard. Once into social media, how to keep the momentum going every day with multiple accounts and continue being part of it? When you have multiple accounts in Facebook, Twitter, Instagram, and what do you advise to the residents?
So I think when you're starting out, start slow. Don't go and sign up for every social media account out there. You'll get overwhelmed. I think for people just beginning, Twitter is the thing that I think is the biggest bang for your buck, as we say here in the United States. It's the most mileage you'll get is Twitter, because you'll meet a bunch of people. It's very open. It's not private, so it doesn't feel scary like Facebook might to some people. Or if you like Instagram, Instagram has a lot of great pathology content too. Each of the platforms works a little differently. I think most people are already familiar with Facebook. Twitter's quite different, and I forgot to put it in my talk, but I've got it on that website. If you Google social media guide for pathologists, I've got a lot of tips in there, and I also have my 30-day challenge that I say when you start, if you want to start Twitter, get on Twitter and tweet, go on there every day and follow 3 new people and retweet 3 things, and you can even take the weekends off if you want, and do that for 30 days, and once a week, tweet something of your own, a picture of molluscum contagiosum or something simple, squamous cell carcinoma. It doesn't have to be something rare. And then if after 30 days you'll have kind of gotten the hang of it, or if you decide you don't like it, then give up, and then I'll never bother you about joining Twitter again. You gave it, the old college try in that case. Right. But I think that the way I manage it, I mean, obviously I'm kind of a professional now at this, and this is something I've got a lot of experience. I use an app called Buffer. There are other apps like Hootsuite and TweetDeck, and you can schedule tweets. So when I have a spare block of time, I can sit down and I can create 10 tweets, say, and instead of all 10 of them coming out at once, I can have it set to tweet that out 1 per day for the next 10 days. And I can also say, oh yeah, and also post it to Instagram and to my Facebook page, so it can share across all of the networks. And that is one way for content production and sharing. That helps a lot. The other great thing about that is you can go back to your old tweets and reuse them again. So many of you who follow me have probably seen there's a lot of tweets that I reuse again and again because I'm lazy and I don't have time to make new tweets now because I'm giving lectures about social media and making YouTube videos. So that's helped me get a lot of mileage. Also for hashtags, I program in your phone, you can actually use text replacement, and you can make a little code that will put in a whole list of hashtags. Things like that are little tricks that will make you faster. But I think don't feel the need to do everything. It's okay if you don't, if you don't use every account every day. It's okay to take a break. If you feel stressed out when you open up an account, put your phone down and go do something else. Take a walk outside, play with your kids. Life's too short to worry too much about this stuff. It's important, but
that pretty much answers Supriya's question, that tips for residents getting started. Maybe she can navigate through the tips what you have posted on your website, right? Okay. There is a question like, how do you address if someone is pulling down on the social media for your content being posted? Dr. Cameron, can you answer that?
Sure, I missed the
somebody is
first
trying
part.
to pull you down.
Oh, like be negative?
If somebody is trying to pull you down, yeah. Negative. How do you attend to the negative remarks?
Oh no, I'm getting all the negative questions. So I have to say that can definitely be bothersome. All right, I have to admit. So everyone has a different level of thick skin. So you have to develop a thick skin. Okay, this is what my boss here, Dr. Eva Wojcik, my chair, always says. You know what? We have to professionally develop a thick skin. So you have to kind of understand, have insight, see if they are truly commenting on something that you might actually have to address, right? What if it is true, like they're actually saying something correct which you don't like? So have some insight. But beyond that, there are many people who will choose, this is my way or the highway, right? My opinion is the most important opinion and your opinion doesn't matter. So you just in one ear out the other. If they're very, very bothersome, exactly, wash your hands of it, like Dr. Gardner is motioning. I mean, there will always be the haters, there will always be the losers, there will always be the people who are jealous, and that's okay. I mean, that's fine. They have their own strengths, you have your own strengths. However, it can get to a point where people start harassing you, and that is not acceptable, right? There have been recent cases, which I'm sure the people on Twitter have seen. That is not acceptable. But I would want to focus then on the fact that, we all of us on Twitter, we saw the response that happened, right? When that harassment became out, from all parts. We just destroyed the harasser, right? I mean, that harasser was destroyed. So wherever we find a negativity, we can almost always find a positivity. So I would like to, I call myself a controversial optimist, because I'm an optimist even in the worst possible setting. I'm controversially optimistic, which might not be what everybody should be, but I find that there are always some nuggets of positivity. So try and avoid. But if you're really being harassed, that can be a big problem. I'm really not downplaying that. Harassment is a big issue, and I'm really hopeful that nobody falls into that.
Thank you, Cameron. And you have a positive question now. Can this pave the way for establishment of transcontinental universities? The pedagogical tool what we told for undergraduate and postgraduate teaching. How can you bring in
whoever read that question? Good, 2 thumbs up. We have to found this university ourselves. Yesterday, the medical student who I co-founded the pathology elective with. So let me preface first by saying I hate virtual stuff. I love in-person stuff. But there is a beauty to virtual. There is an ease to it. There is a cost efficiency to it, right? There are so many benefits of it. So yesterday, my medical student, Cullen Lilly, I don't think he'll be watching right now, but he co-founded it. And he was, him and I were throwing around the idea of just a completely virtual conference. Just do it online. Like I understand that this is a virtual conference, but a total social media based conference, right? Why wouldn't that be able to happen now that we've seen because of COVID? So similarly, universities are a little bit harder, right? Because you need to have an education degree granting board. So I doubt that this will happen so quickly. However, snippets of that are already happening. We have online degrees. People have online degrees. What are those? I understand that they're housed in institutions, but most of the content is generated online. So absolutely, I think that is something that will happen. For people who are rigid and who aren't willing to accept that it's going to happen, I think that their eyes need to be opened. You have to be familiar with what is going on around you. You can't sit in a silo. You may not love it. I don't love that idea, but if it happens, I think it's very important for educators to embrace it so that we can make it happen well.
Amazing. I think we have a few more minutes, Aditya, to take a few more questions.
Yeah. Jaram, I think I have directed a few questions to you. Could you please take them? Pose it to the speakers.
Yeah, there was one question by Mr. Dr. Ramaswamy. In the days of social media, do you believe publication should be open access mode only? Who would like, Gerard? Would you like to take this?
Yeah, I mean, ideally, I think
Whatever
it
you
would be
publish,
great for all publications in the literature to be free and open access. Logistically, I understand that there's difficulties to that because publishing companies have to employ people. They have to make money somehow to fund the work. But I do think that the expensive cost to access journal articles is a significant problem that we have to overcome in academic medicine. The people who write the papers do it for free. The people who review the papers do it for free. And the people who need access to the papers have to pay money. And if you don't work at a university that has a subscription, it's a lot of money, especially if you're someone in an underserved area and you don't have the kind of wealth that countries like the United States have. And so I do think that's a big problem. I do not know the full solution, but I think that more and more people will begin doing alternative forms of publication that can be peer reviewed, like through social media. And there's some other websites that are starting to work on this, and that will make free open access things available. And I do think there'll be a shift over time as people are realizing that traditional impact factor of journals is not nearly as important now as it was in the past. I have my own impact factor. If I write a paper, I don't care whether the journal has a big impact factor or not. I can get it out to thousands and thousands of people in no time with my channels. So I think that's really changing the game. And I do think this will shift in the future, but it's going to take time, unfortunately.
Yeah, thank you. I think Dr. Raj, no question, but then there are lots of followers today for you. Suman says, he thanks immensely for your selfless support and for you to distribute knowledge through Path Presenter. Yeah.
I had
I
a question
have to second that, honestly, because, for example, here at Loyola Pathology, we do our unknown sessions with them. We do tests with them. I use them for Path Elective. I use it for, I mean, there's so many uses. He is an unbeliever. Dr. Singh, we really, really appreciate everything you've done.
Thank you.
There's a very interesting question here, Vijay. I think I'll direct this to Dr. Raj because he seems to have the most Indian experience among the three of you. What are the medical legal implications while using social media for pathology? In India, there are no laws.
I think Gerard addressed it a lot. I mean, you can answer it through an Indian perspective, probably.
Yeah, like the important thing, as Gerard stressed on, is we have to make sure that we do not have any PHI on the images that we share, basically, and that is a very, very critical part. Even if it is US, if it is Europe, if it is India, because patients shouldn't be able to say that they shouldn't feel that their images are being used without their permission, actually. And if you don't have any PHI, then it cannot be traced to a patient or an institution, and then that makes it a much safer way to use that information. We have asked many patients also, are you okay? Many patients are actually very happy. If Gerard can also attest to that, when he's talking to all these social media groups, that patients actually want that data to be used for learning and teaching, actually. But we have to be very conversant of the rules and regulations. It's not the patients, but the rules and regulations that can get us into trouble. So as long as there is no PHI that can be traced back to the patient, I think then you are okay with using any kind of medical data on social media.
Okay, thank you, Dr. Raj. And sir,
from my side.
Jairam sir will be asking questions.
Yeah. One basic technical question for you, Dr. Raj. When someone wants to upload, say, a whole slide image onto the Path Presenter, is there any specific format or compatibility issues when you have a BIF or a TIFF or a JPEG 2000 image? Which kind of images would the software accept?
The way Path Presenter works, it will actually, because pathology has multiple file formats. So you have SPS from Aperio, TIFF and iSyntax from Philips, and NDPI from Hamamatsu. So we have tried to make the software in a way that it will take the slide from any scanner. There are some formats that might still not work, but we are working on those. But it will take slides from any scanner. Even if you have the label on the slide, it will make sure that the label is not visible on Path Presenter. So we take care of the PHI not being shown on Path Presenter. It will convert the file into another file format. And then that is what you see. So all you see is a converted file from any file format into with no PHI on Path Presenter. So it will take mostly all the common file formats. It doesn't depend on what scanner you are using in the institution.
Okay. Sir, is there any question from your side? Yes. Jairam sir? Okay, I have one question if there are no questions.
there's a question
in
here.
Indian context, we don't, not many are Twitter users, Dr. Gerard. Most of us are, on WhatsApp and Telegram and such things. Now, Dilip wants to ask you any experience about using WhatsApp, which is more popular in India, in education and learning.
So I tried WhatsApp a little bit, but I never really got into it. I found it a little difficult to use compared to other things because many of the things in WhatsApp revolve around groups, right? And what I find is that groups can be useful for people who want to have a private discussion. But for me, again, I want my content to get as widely disseminated as possible. So I really favor using platforms like Facebook pages, Twitter accounts, all the things I talked about in my talk, because it allows the widest number of people to have access. And also, I just felt like WhatsApp, it was just too difficult for me to keep up with all these different groups and what was happening there. So if you use it and like it, great. I mean, that's the thing. You have to find what works for you. Just because I do something doesn't mean that everyone needs to do it. I think there's a lot of different ways to do this. I'm just sharing kind of my journey, and you can glean from it what you like. But I do think, I will say this to everyone one more time, if you're not using Twitter, I really think you're missing out on an amazing, special community of people, not just the tweets and the pictures, but the people there and the way that people interact. It is a different feel from Facebook or any other platform. And it's a wonderful, inclusive place where everyone gets along pretty much and likes to welcome new people and will give you advice. If you're a med student and you want advice, there will be tons of people who will tell you advice about becoming a pathologist. It's really incredible. So that's why I really focused on that here, because I know that's true that in India, Twitter is not as big, and I'm going to try to change that.
So
great,
one last
wonderful.
question.
You answered that question. What is Twitter and Facebook and Instagram? Which ranks first? You answered that question.
So one last question can I take?
Yes,
this is on behalf of Dr. Raj Lakshmi. She has had some social media posts being taken down, even de-identified medical pictures as sensitive. Is it possible to push for a separate set of guidelines for reviewing pictures on medical, academic, and teaching groups? Dr. Cameron, you can take this.
Oh, that's a tough one. I'm pretty certain that there's. I'm not sure which one, which platform she was using where it was taken down. I'm assuming it was probably not Twitter. But as you all know, the Instagram platforms have the sensitive warning, things that come up, and so that automatically allows individuals to choose whether they want to view the content or not. I don't know exactly how explicit this content was. Was it an autopsy content, or was it something that was just very gross appearing? But I think that, depending on the platform, so Twitter, I don't think has that access. Jared, you can correct me if I'm wrong. I don't know if Twitter puts in automatic sensitivity, does it?
It does, but it's not very often. It feels like the one time I saw it is I posted like a case of Haley disease, and it was an axilla, and it flagged it. I think it thought it was like the curves of a breast or something. So I think it has some kind of to filter out pornographic things, but it's a pretty loose filter. I've not had very many of my things flagged there.
Right. I mean, I think that, if this became a serious problem, I'm pretty certain a band of pathologists could get together and, maybe advise, these social media platforms as to like what, pathology related guidelines could be. But yeah, I mean, I think that even if you do have an image where part of it is going to be considered, kind of graphic, you can always, and if it's not relevant to the thing that you're trying to show, you can always try and cover that part, right? Like just put a cover on it. Like in old school, I remember my parents are physicians, and in old school books, and I'm sure it happens even now, like, to de-identify a person's face, they would put like a strip over the eyes, right? As if that de-identifies things, which is fine. But if that type of thing helps, then that's great. But otherwise, I think at this particular moment, I mean, especially in the blood, I've never posted anything that, is that graphic. However, if need be, just like Dr. Gardner has led the way with the ethics in pathology posting, I'm pretty certain we can come up with a guideline for graphic content as well.
And we're glad that CAPCON 2020 is a place where that discussion started, and it will take to a conclusion, I'm sure, with this.
There we go.
So with this, I think, shall we end the session? I think it was a great discussion.
Yes, I think we have many more questions, but unable to take those. And thanks, Dr. Gerard, Dr. Raj, Dr. Cameron, for coming over here and then virtually, though, and making this an awesome presentation. Thank you very much. Wonderful session we had.
Thank you for the opportunity.
Thank you all.
Thank you.
It was awesome.
Thank you
Love
all.
you guys. Bye.
Thank you.
Bye.
Shall we close the session now? Thank you.
Yes.
Thank you.